Welcome to our channel where we are giving tips for surviving motherhood and providing a place for honest conversations about women's mental health. We make new videos every Monday, every week. We hope you like our videos and don't forget to subscribe below. Today we're going to talk about postpartum depression, the risk factors that may increase the likelihood of one developing it, and the signs and symptoms that one can look for if they are experiencing postpartum depression. Even though we're hearing about it more and more and raising more awareness about it, it still seems like there's a lack of knowledge. Can you tell us a little bit about postpartum depression?
That is so true about the lack of knowledge, Felicia. So first, I want to say that postpartum depression can actually start during pregnancy or after birth within that first year. So 10% of women will experience depression during pregnancy, and up to 20% will experience postpartum depression. So that makes it the #1 complication of childbirth. So that means postpartum depression is even more likely to happen than any of the other things that happen during pregnancies, such as gestational diabetes, high blood pressure, and so on. And so a few of the signs and symptoms of postpartum depression kind of include feelings of anger or irritability, having a lack of interest or feeling detached from the baby, feeling numb. There can be appetite changes, so either eating a lot or just not eating at all. Sleep disturbance. Now we know as a new mom that sleep disturbance is happening anyway, but with depression, we're talking about either not being able to sleep when it is time to sleep or there are opportunities to sleep, or just feeling like you want to sleep all the time and just can't get out of bed. A lot of crying and sadness, feelings of guilt, shame, hopelessness, and then we have the lack of interest and joy and pleasure and things that you used to enjoy, which is why it also kind of affects how moms feel about their baby, because that includes not having joy and pleasure in their baby. And then also possible thoughts of harming self or the baby. So just want to say that you don't have to have all of these symptoms, but any of these symptoms could be possible signs of postpartum depression.
Yeah, I think these symptoms seem kind of confusing for people to recognize their postpartum depression because a lot of them are normal signs of just motherhood, struggling to sleep and the baby keeps you up and you're feeling overwhelmed because whether or not it's your first baby or you're adding on more children, mom life is overwhelming. But it's important that we see that it's more than that. It's no longer the baby more than 2 weeks postpartum. And it's also important to just see that these symptoms are not at all the baby. Thoughts of harming yourself or your baby.
Absolutely. I think many times that really does happen is because where does new mom symptoms and postpartum depression begin? It can be a fine line. And so many times moms might try to reach out for help and they might get told it's just the blues, especially because most people don't realize if it's been past 2 weeks and you're still having those kind of feelings, then it's probably not the blues anymore. And that you don't have to feel bad. Part of being a new mom isn't feeling depressed and crying and sadness all the time. So that does make it really difficult for a lot of people.
Yeah.
And also the fact that these symptoms can appear at any time during that first year is another big factor that most people don't realize. So if a mom comes with a 9-month-old talking about feeling sad and crying, many times people will brush that off and say, well, your baby's 9 months old, it can't be postpartum depression, when that is simply not the case. Or maybe baby is older than 1 year old and these symptoms began during that first year and it's just not been treated. That too is still postpartum depression.
Absolutely. You have to trust how you feel. If you're not feeling like yourself normally, don't let people tell you it's nothing or it's the baby blues. Keep reaching out for somebody until they do give you the help you need.
Absolutely.
So what are some of the risk factors that we can look for to help somebody identify that they may be struggling with a perinatal mood and anxiety disorder or postpartum depression?
The following risk factors, you may not get postpartum depression. There are certain risk factors or red flags that if you do know about them, you can be educated and be prepared. Some of the risk factors include having a personal or family history of depression, anxiety, or even having postpartum depression in the past. That does put you at higher risk. Being sensitive to hormonal changes. So what that means is maybe having PMS or PMDD, or having a reaction to birth control methods. Having inadequate support in caring for the baby, financial stress, marital or relationship stress. If the pregnancy was unwanted or unexpected is a risk factor. Also, any type of complications in the pregnancy, complications during the birth, having a traumatic birth, breastfeeding struggles, whether that's not being able to breastfeed when you want to, breastfeeding not going the way it should, the way you would like it to go, having a history of miscarriage or pregnancy losses, infertility, having more than one baby, having multiples, twins, triplets, and so on. Having a baby that's in the NICU is also a risk factor. Any major recent life events, losses, house moves, job loss, any of those big stresses are also risk factors. And then also thyroid issues. So moms that have had a thyroid imbalance and moms with any form of diabetes, whether that's type 1, type 2, or gestational. So all of these can be risk factors for developing postpartum depression.
Yeah, I think it's so important that we recognize these risk factors, but to also know that any of these risk factors can be a sign of postpartum depression. It doesn't take someone having all of them. It just takes having some of them, but you may also find that you do have most of them. You can also have no risk factors and still get postpartum depression. I've seen this firsthand with moms sometimes. But if we're able to discuss these risk factors with parents ahead of time during pregnancy or like at their first preconception appointment or their first baby appointment, then we can start helping them develop a plan and become more aware and get help early on.
Absolutely, absolutely. So while you may not be able to prevent it, definitely having that conversation can make everybody more aware of it. There are some things they can do to provide some of those supports in place and know the treatment options and know where to go to treatment. I think women could get the help they need so much faster if we all knew the risk factors along with the signs and symptoms. But postpartum depression is not psychosis. There's also a whole other side of perinatal mood and anxiety disorders that we haven't discussed today, such as postpartum anxiety, but it can be even more common.
If you or someone you know is struggling with postpartum depression, please reach out to the PSI warmline, text line, or your local ER for immediate help. So what concerns have you heard about postpartum depression? Was there anything here that surprised you about postpartum depression or anything that you wish others knew? Comment below and let us know. That's all for today. Thanks for watching. Don't forget to subscribe to our channel for more videos about surviving motherhood. Bye.
Bye.